My name is Jelina and I was diagnosed with breast cancer in 2012. Every single year I used to go religiously for my mammogram, and this time they discovered that there was something unusual.
Jelina is a young lady who was diagnosed with having a tiny tumor, 0.4 centimeters. But she had 2 positive lymph nodes. She received TAC chemotherapy times 6, and then began endocrine therapy. So we've been into therapy with her for 3.5 years, and I sat with her and I asked her, there is data to suggest that some patients get benefit for longer therapy. I think you're one of them. But there's a new test came out called the BCI, and they can look genetically at the tumor and help us predict if you're going to have a likelihood of a longer response and actually help us with the risk of recurrence to help us know.
And of course, when Dr. Silva told me about the breast cancer index, this way I could know if I needed it for 5 more years to take pills or just stop. So I said right away, yes.
So those patients that are high, for instance, high risk of recurrence with a high benefit, it's a no-brainer. Those women, are you don't even have to say another word and they're on it. And it came back as high risk of recurrence and high benefit of treatment. So she is really the ideal patient that it worked out with for her to have longer therapy.
I was a little disappointed because who wants to keep taking pills? And of course, and all these hot flashes and other things that you don't feel like a woman anymore because you lose other things. So it was disappointing having the test results, but I said no, I have to keep doing it because I don't want to go back. This is the way it is, and it's okay, because I'd rather be alive and not go what I went through.
I don't look at a tumor by size anymore. I look at the biology of the disease. Any information that could illuminate which women should be treated for longer to prevent the recurrence of disease, that's always a win-win. The patient is always the captain of the ship and they can decide yes or no. But if we have that option, we can really tell her, look, with this genetic test, we can determine that you would really get a benefit out of this therapy. We should not stop, or we should treat you with this.
Now I know that it was so aggressive that I need to take those pills for a much longer time. That's what I think. I need to do it. And I've never missed a dose, or maybe 1 or 2, but now I definitely say I cannot miss them.